Good evening, everybody. This is Diane Munch. I am the leader of our professional practice team here at the Robert H. Lurie Comprehensive Cancer Center of Northwestern University. I'm very excited to welcome everybody to our Cancer Connections program this evening. I know that some of you have been members before. We have quite a few patients, family, caregivers on the presentation this evening. So we're happy to be able to bring this to you virtually so that you can enjoy the presentations and the speakers in the comfort of your own home. I do want to mention that we usually choose a theme for our Cancer Connections, and this evening's theme is self-advocacy. We have some wonderful speakers that are going to talk to us about how, as cancer patients, you can search for information, learn about your disease and your treatment, and find resources that you might need in the course of your cancer care experience. I do want to take a moment to thank our advocacy partners. I hope you had a chance to look at our virtual presentation from 5:45 to 6. It was on our event web page in our virtual resource fair. I hope you had a chance to learn about some of the services, and I think later in the program today, we'll talk directly about some of those for you. And then, as always, thank you to our speakers who have given their time tonight to present some very important and very informative topics for you today. So with that, I am going to introduce our first speaker. Actually, it's a team of speakers. If I can have Valerie and Stephanie join us. I'm pleased to introduce Valerie Jonkoff. Valerie is actually a Lurie Cancer Center patient. She finished treatment in 2020, and she works as a creative director and volunteers her time by serving on our NM Patient and Family Advisory Board, as well as the Associate Board for the Lurie Cancer Center. She's going to be joined tonight by Stephanie Bradley. Hi there. Hi, Stephanie. Can you hear us? Okay.
Yeah,
she's joined by Stephanie Bradley. Stephanie is our advanced practice provider, our APP nurse manager, and for the Lurie Cancer Center in medical oncology. But she is also, or was also, Stephanie's advanced practice provider in the practice that provided Valerie her treatment when she was undergoing treatment here at Lurie last year. Stephanie is a family nurse practitioner, and she specializes in gastrointestinal oncology. So thank you for joining us tonight, Valerie and Steph. We're very excited to have you. And I'm going to turn the program over to you.
Awesome. Thanks, Diane. Stephanie, if it's okay with you, I was just going to share my story for a little bit, and then I'm going to ask you a couple questions.
Absolutely.
All right, cool. Let's do it. So hi, everyone. As Diane said, I'm Valerie Jonkoff. And when I was 29 years old, I stopped being able to get out of bed in the morning to go to the gym. And I know that sounds like a non-issue, because who among us has not abandoned a morning workout routine, or any workout routine for that matter? And a little humble braggy, because we get it, lady, you go to the gym. But it's something I've been doing since I was 16. I'd wake up at 5 a.m., I'd go to the gym. And one day I just couldn't get myself there anymore. So I brought it up at my next physical, and I came prepared to go like full John Grisham to my PCP. I did all this work. I was really preparing my case of why this was an issue and why we should take it seriously. But it turns out it wasn't necessary, because my PCP listened to me. She noted it in my chart, and we monitored it together. But when I came back a year later, still unable to make my morning workout, and now with the added symptom of just a little bit of blood in my stool, she escalated it immediately, and voila, I was diagnosed with stage 3 rectal cancer at 30 years old. Now, I tell you the cancer Aesop fable of the girl who couldn't go to the gym anymore, because it's the first instance in my cancer journey where I had to advocate for myself. I know my PCP was receptive and listened to me, but I think that's in part to how seriously I was taking it. I mean, it's such a small symptom, obviously, and it led to a life-changing diagnosis. And I also think being 29 kind of factors in here. It's really easy to assume that you're young and healthy and it's all fine, while stage 3, turns into stage 4. And it happens to countless cancer patients, AYA, adolescent, young adult, or otherwise, where you have to be your own advocate. And it really set the tone for how I approached almost every interaction I had with my care team going forward. If you're here, it's most likely because you are a patient or a caregiver with Lurie Cancer Center. And since going through treatment here, I now consider myself a Northwestern snob. Personally, I think we're at the best cancer hospital, number 6 in the nation now, to be exact. And no one is paying me to say that. Actually, I'm kind of paying them, if you really think about it. So in my experience, being at Lurie has meant I've had a fantastic care team. Stephanie was an integral part of that care team for me, and one who really listened to me all the time. But the key to that statement isn't how great the team was, it's that they listened to me. And if they were listening, that meant I was talking. I, as Stephanie can and will later attest to, was always talking to my team about anything I wanted to bring in the room. Like, seriously, I would talk to my care team about like a weird rash I got during chemo, about getting a second opinion, about convincing my family sugar didn't cause my cancer. I brought them cancer memes I read on Instagram. I asked them about a recommendation I got that someone gave me to try coffee enemas. I asked them about having sex during treatment, if I could get a medical marijuana card, what I could or couldn't eat. And I mean, the list, it never stopped. I brought everything I could think of to them. And with every conversation, we built a stronger bond, and more trust came from that bond. And the more they got to know me, the more they could help me. If I said like, hey, Stephanie, this med sucks, she would often say one of two things, like, yeah, man, I'm sure it sucks, but it's what you need and it's what we've got. Or she would be able to say like, okay, it's good to know that you're experiencing some not great side effects. Like, let's work together and find an alternative. They were able to do things like they got me to see a cancer dermatologist, which I naively didn't know that was a thing. They encouraged me to get a second opinion. They helped me manage conversations with my family. They laughed at the memes. They forbid me from ever getting a coffee enema and said it was fine to have sex, got me the paperwork for the card, you get it. They were able to help with just about everything I brought to them. And all of which to say is your care team can be a lot more valuable than you realize. They want to help in truly every way they can, but they can't do anything if you don't advocate for yourself, if you don't share your experience. I'm also of the opinion that the less you share with your care team, the more likely you are to share with Google. Googling your symptoms, remedies, alternative treatments, etc. And I think everyone here on this call, if you are a patient or a caregiver, knows exactly what happens when you Google cancer. It's destruction of the universe. The world is ending. It's total insanity. So instead of sharing with Google, I share with my team, and I would encourage you to do the same. And my oncologists, and at the time, Stephanie, my APN, were and still are incredible. But they were only amazing because I was amazing. And yes, that one is a humble brag. But seriously, talk to your team, be an active participant in the care you're receiving. I know as patients, especially, you sit in that waiting room, you're waiting often for a long time, you feel like you're just a number, or, you feel like you're in a rush and your doctor doesn't have time, whatever, but they do, and they'll make time for you if you're willing to share, if you're willing to bring them into what you're experiencing. So I encourage you to push back if something doesn't sit right, or tell them, both the good and the bad, and ask for what you need. And in my experience, and I hope it's something you experience too, the only thing it can do is help. And I mean, this is coming from someone who went to a doctor in the 21st century and said, I'm tired. Like, we're not all tired all the time, but look where it led. I mean, I'm still here today because they said something. And yes, this is also humble braggy. I'm able to go to the gym in the morning again. So thank you for listening to a little bit about my story. I appreciate it. And now, Stephanie, join me. I have some questions for you.
Hi, everyone. Valerie, I'm looking forward to your questions. I would just like to say, in my previous role as a GI advanced practice provider, Valerie and I definitely developed a significant relationship. And it's very important that you have that relationship and you develop that rapport, because something that Valerie mentioned is very important, because the more comfortable you are, the more likely you are to share. So I will allow you now to question me.
And it's true. I mean, and it's hard to share with your doctors, and Stephanie thankfully made it really easy, as did my oncologist, Dr. Mulcahy. But the first one, Stephanie, is really hard. How annoyed do you get when patients ask you about stuff they read online?
There is absolutely no annoyance. I look at it as a person being concerned, right? And as you are navigating this journey, there are going to be different milestones where you're incredibly concerned. Prior to receiving chemotherapy, you may have the symptoms of the disease that you've been struggling with, but now we're giving you some medication that will likely cause you more side effects. So as your treatment progresses, there are definitely going to be moments where you have questions. And these things may hit you in the middle of the night. You may wake up and you're vomiting and you're like, okay, let me look online here and see what they say about this. And you go online and you read things. And of course, some of us proactively, ask questions. You come to that first visit and you have 10 to 15 questions already written down. I love overachievers. I love when people are ready for their visit. It makes the visit easier for me, actually, when you come prepared with questions, because that way you're basically navigating your visit. And it's not like a lot of me just rambling, because once you go through treatment or about to start treatment, there's a lot of, if you will, there's a spiel that comes in, right? It's, oh, this is chemotherapy. You will experience likely nausea, vomiting, diarrhea, constipation, and yada, yada, yada. And it's just me just talking about what you could potentially experience. I find it a lot more gratifying and a lot more useful when a patient comes in and they're like, hey, Steph, I have these questions before you go into your lecture. Can you answer these questions for me? And that way, we probably more than likely will cover everything that I was going to say anyway, but it's more tailored to your needs. So I never got annoyed, or I don't get annoyed because I still practice. I don't feel annoyed when patients come to me with information from the internet. However, I always tell patients to take what you get from the internet with a grain of salt, because while there's a plethora of information out there, it's very hard to distinguish what's fact and what's fiction. And right now with the internet, everyone has a page, everyone has social media, everyone has a blog, so on and so forth. So it's very hard to determine what's fact and what's fiction. And after we get through the questions, I'm going to go over a presentation that I have just about how to navigate Google and how to navigate these different search engines. But short answer, no, I never got annoyed.
Well, and I think it also brings up a great point. Like, I'm talking about self-advocacy, share with your team, your experience or whatever. I think that includes what you're Googling. Like, someone in the chat asked about new journal articles. Is it okay to message to your doctor? Steph, I'll let you answer the specifics about messaging to your doctor, but I would encourage people, like I did, to bring in those articles and also ask your team, like, hey, I know myself, I know I'm going to go down a Google hole. Like, where should I go? Like, what sites do you recommend? And Dr. Mulcahy, part of my care team with Stephanie, actually recommended a great forum with other colorectal cancer patients that I got kind of involved with. So that's also another thing to pull your team into. And I mean, Stephanie, I'm glad you never got annoyed, because I would bring in my notes app on my phone full of questions that I would just collect from the week before. And I would also encourage, if you're a caregiver, to do the same thing. Make that list of questions. Your voice is just as important. You might be thinking and hearing things differently that the patient isn't thinking or hearing, and it can only help the conversation. And Stephanie, I loved what you said about, like, it becomes more of a dialogue. Like, you want to be talking to each other, not just getting talked at, or vice versa. So I'm glad I never annoyed you with my questions.
No, you didn't.
And in the same vein, so how do you approach a patient who's brought you something they found online or through a friend, something that maybe you don't think is the best way to go? What's your approach with them?
So I basically, depending on what the information is, I'm like I said, I'm always cautious of what we're reading and what we're spending time investigating, right? If it's something from, and I've heard it all. I've heard about Facebook groups and social media and blogs and journal articles and trial information. When you're reading this information, it is good to bring it back, because your provider and your care team can kind of help you navigate what's reality and what's not, right? So when someone comes to me with these things, let's say it is a legitimate article that they've read. And they come to me and they say, hey, well, I heard about this medication for nausea instead of that medication. If it's something that makes sense and has been researched in the literature and proven to be effective, let's try it. I also am one to bring in all of the other things that a lot of times articles don't bring into play. So for example, following standard of care, there are certain things that you have to quote unquote try before your insurance may allow you to navigate to something else. So it's kind of like that start low, go slow type of approach. So there are different things that, you know, our patients aren't always aware of, but I'm definitely, and our team is definitely one, we believe in research, we believe in science, and, you know, we don't know everything. Like physicians and APPs, we don't know everything. There may be something out there that's hot off the press that we didn't get the notification to our email yet, and someone else came across it, you know, and there are no big I's and little U's. I mean, I feel that the team at Northwestern, we're very, very supportive in patients advocating for themselves, doing research, obtaining second opinions. We're definitely, you know, proactive and also suggesting like, well, hey, you know, do your research. And as you were describing about family members and caregivers, they are integral in this process, because a lot of times, you know, our patients will come and we will have this long dialogue. And by the time they get home, they're like, I don't remember anything she said. And there was another person there. It's like, well, no, she didn't say 2, she said 1, you know, and somebody who
it's important
to help you validate like what the instructions were. You know, caregivers and family members are golden. They're very integral in this process. I always say, write your questions down, because sometimes as a physician, especially with, you know, our physician colleagues, you know, patients kind of get afraid, you know, to bring up a question, you know, when a physician is speaking. But if you have them set and you say, well, hey, Dr. So-and-so, I have these couple of questions. Can we go over my list first before you start, you know, giving me your opinions? And that way, you know, for a fact that everything that you were preparing to ask in that visit gets addressed. So I think it's key that you are doing your research, that you are researching appropriate articles,
right.
And not necessarily, you know, things that may not be true. A quick story, I had a patient once come to me and she brought in some information about her disease that someone else had went through. And these stories don't include everything. They don't include their path report. You don't know if a person is triple negative or ER positive or HER2 positive. You don't know the different characteristics. Sometimes you don't even know what stage they were in. You don't know what different type of chemotherapy options they got. It's not a one size fit all. So I always tell my patients, like, cancer care is not a one size fit all. You can have 2 patients with the exact same pathology report, but you have to go a different approach based on other things. Age, for example, prior medical history, those things aren't included in those blogs. So you want to be very careful what you utilize and what you research, and try to assess it as something that might also be going on with you.
Well, and I mean, I think it's such a good point because of why you should bring these things to your care team, because you know, Stephanie just brought up, there's 100 other factors that me as a lowly creative director who knows nothing about medicine, like would know to put the context around. So I think that that's another great point. And something I wanted to bring up on the caregiver side is it can also be so fortifying to have a caregiver with you to encourage you to ask those questions. And something I did with my family's out of state. So I went to a lot of appointments by myself, but when my parents or whomever were able to come, I said, you can ask your questions when I'm done. Like I wanted as the patient to be in control. I wanted to develop that relationship. So if you are a caregiver listening, I would suggest, you know, try that approach of let the patient take the reins. And then if there's anything they've missed, then you can jump in. So it's not just one-sided. But Stephanie, you touched on something that leads to my next question of it is intimidating. And I've felt this intimidation a lot to bring anything up to a doctor. So you know, and opening yourself up, you know, I talked about a lot of like very sensitive things with you that I wouldn't have been comfortable doing. if I didn't take the first step. So what advice do you have to patients who are nervous to really open themselves up to their provider?
The long and the short of it is just do it. I mean, at the end of the day, this is your life. And while we are very educated, I'm not plugging my team, but the physicians at Northwestern are incredible.
Plug it. They're great.
They're brilliant. I just have to keep it real. They are. But this is your journey, right? So at the end of the day, I can't tell you how to feel. I can't tell you how to process. I can't tell you what you're feeling is not real. Feelings are subjective. In this journey, a lot of it is objective. Outside of scans and things like that, there's nothing to measure here. You know, if someone is coming to tell me, oh, my pain is 10, who am I to say, well, no, I think it's really a 3. No, your journey is your journey. So you have to make sure you're advocating for yourself at the end of the day. And even when it's uncomfortable, let's say, okay, you may feel like, okay, I really didn't feel too comfortable with this physician. You know, maybe when you see the advanced practice provider, see if you feel more comfortable with that person and you raise those concerns there. Or there may be a nurse. I mean, this is a multidisciplinary approach within our cancer center. It's comprehensive. So we have dietitians, we have social workers, we have palliative care, we have nurses, we have doctors, we have APPs. We are fortunate to have many, many, many professional people that I'm sure you can find someone to connect with. If it's not your physician, it may be your APP. If it's not your APP, it may be your clinic nurse. If it's not your clinic nurse, it may be your infusion nurse. Or you may talk to the social worker and develop a bond with them. We have so many resources within our cancer center. I am more than certain you will connect with someone. And at the end of the day, if you don't feel comfortable, again, use your caregiver. Use one of your family members who may be a little bit more assertive than you. Utilize the resources that you have. But I think if the physician, if it's uncomfortable with the physician, then you can always connect with somebody else. The other thing, we have the wonderful My Chart option. You can always write. Sometimes, you know, patients are a little timid and they don't want to ask certain things in person. And it has nothing to do with being comfortable. Like some people are just bashful. Like everyone is not as assertive to be like, well, hey, I want to have sex. What do you recommend I do? Some people are a little shy and they may want to send that through a My Chart message, and that's okay. I mean, that's what we're here for, and we're here to help you guys in any way that we can.
I think that's such a great suggestion, because then it gives it back over to the healthcare provider to then come back to you. So if I say to Stephanie in a My Chart, like, hey, I want to try medical marijuana, but I'm too afraid to bring it up, then Stephanie can bring it up to me and that conversation flows. So I think that's such a great suggestion. And so Stephanie, what's your reaction when a patient opens up to you? How does it make you feel?
I mean, it actually makes me feel accomplished. It makes me feel good. It makes me feel like I've made the connection that I'm supposed to. I mean, having a cancer diagnosis is not like being told your blood pressure is 140/90. This diagnosis impacts everything. It impacts finances. It impacts your sex life. It impacts your family unit. It impacts everything. And the biggest thing is the loss of control. You know, now, whereas you had a free schedule to do what you want to do, now I'm telling you, oh, you need to be here every 2 weeks at this time, from this time to that time. And it's like, but wait a minute, I do bingo on this day. And it's like,
I have a life.
You know, I have a life outside of it. You know, but it makes me feel great to know that a patient is comfortable coming to me and confiding in me and being open enough to ask me whatever. It makes me feel like I've done my job. It also sometimes, if I'm being honest, can be a little uncomfortable. Like if you have, I hate to keep going to the sex thing, but like an older patient, like asking me that, I'm like, oh gosh, but it makes me feel good. And I know that I have to be the person to get you the answer. And there may be things I don't know. Again, like we don't know everything, but the onus is on us to find out. So if you come to me and you say, hey, what about this? You know, can you tell me about this? And I may not know. then it's like, okay, let me find this out for you. And then I'll come back to you.
Awesome. Well, I think we have to wrap it up. I just have one final question for you, and it's very important. It's the most important one I'm going to ask. And it was I your favorite patient?
Absolutely.
You're amazing, Stephanie. Thank you so much. And thank you to everyone for listening to both my story and Stephanie and I having a conversation. I hope you found it useful. And I don't think the two of us can encourage you enough to just open up, have the conversations you want to have with your healthcare team. So Stephanie, I don't know if there's anything else you want to say, but I'll hand it back over.
Okay, I'm gonna go into the slides that I have really quick. I'm gonna share my screen here. So tips for searching the internet, information gathering. It's very important that you are researching information from credible sources. You have to make sure that the sources are credible. And how do you do that? One may ask, okay, what determines a credible source? Who sponsors the website? So if it ends in gov, edu, org, those are typically safe sites that you can look at. You know, anything that has the government associated with it, or different organizations like our organization, Mayo Clinic, Memorial Sloan Kettering, so on and so forth. And of course, NCCN. Those are the sites that you want to utilize. You also want to pay attention to who wrote the information. So again, like I was saying, about blogs and different things like that. And also, when was the last time this information was reviewed? Cancer care rapidly changes. Every other day, there's something new. So we have to be up to date. So you want to make sure that the information that you're reading is up to date. And you also want to know, what is the purpose of this website? Is this website trying to influence me to buy something? Are they trying to get my personal health information? So on and so forth. You want to make sure that you're scrutinizing these sources appropriately. Health on the net. So HON certifies helps websites that comply with ethical and trustworthy practices. So when you see this signal or symbol, I should say, on different websites, that's a good and credible website that you should look into. Gathering information, and more importantly, you can look at all of these things online, you can do research, but always double check it with your team, your physician, your APP. They are well aware of the different things that are out there. So you always want to be sure to circle back with your team. As Valerie mentioned a little while ago, bring those articles with you, share them, and talk to your healthcare provider about that. Most institutions have a patient education coordinator, a health library, and NCCN is an amazing resource for patients. I would recommend using that. And they also have a site where it's just for patients. So it's not like this high technical terminology. It's definitely patient savvy and information that is digestible, that you don't have to feel like, okay, I don't know what they're talking about. It's a good site to use. Beware of the blogs. You want to beware of the blogs because that's personal opinion and everybody's journey is different, like I described. So you want to make sure you take those type of things with a grain of salt, and try to avoid them in terms of getting, research from or different, patient care methodologies and things of that nature. If it's something that you just want to go on and chat with someone, just like for emotional support, that's one thing, but just beware of the different healthcare treatment things that they have. So these are a couple of sites that are good. I'm going to look over in the Q&A. So I have one question here. If my physician assistant for my medical oncologist is enlisted as a provider on my chart, how do I communicate with her on my chart? So you can send a message to the provider that's listed and you can say, this message is for Stephanie Bradley, or this message is for Diane Munch. And that message will get routed to the appropriate person.
Can I just add, Steph, this is Diane, that if a patient has a provider at Northwestern and they're not listed in my chart, then that's a technical error that needs to be reported to the team, because if they can't reach their PA or their physician, other patients may be having the same problem. So we would encourage somebody that finds that problem to report it to their team, or even call in and say, you know, ask your question by phone and report to the team that there's a problem reaching the provider, the PA, or the MD by my chart, because that shouldn't be happening.
I think that was the only question from me. Thank you guys so much for having me.
This was a great presentation. I want to thank Steph and I want to thank Valerie, and I really appreciate the fact that you shared your journey that you went on together with the rest of the participants here, and kind of demonstrated for us what a therapeutic and a trusting relationship looks like in a care team. So I hope this was beneficial for everybody, and we're going to move on to our next program. Hang on one second.